you have any doubt. Welcome, Sarah.
Thank you. Thank you. Thank you. Does anybody have any doubts?
So if anytime you have a question, please unmute yourself and ask. In the meantime, in the meantime, I'm asking a question again. I'm taking over discussion. The last question itself, I'm handing over the question from Divya to Sarah. Again, effect of my gross motor system on my fine motor system, specifically speech. So
Speech.
Sarah is a speech and language therapist. What is your observation? What is your line of treatment for the children? Just when a child comes to you that my child is not talking, then just working on speech or speech related exercise is helpful to what I mean, have you seen those things working, or you have like recommended or figured out that there is so much more needs to be done? So please share your experience and your knowledge about it. That yeah.
So I think so yeah, like we've been talking for quite some time right now. I think the initial thing is always everybody just sees the speech difficulty. Like what Divya was saying and what ma'am was saying before is that if your system is not intact, we just look at speech and we think it's a very easy thing because it's very easy for us. But there's close to 4 or 5 systems that are apart from your brain that needs to work in coordination for us to be able to say speak. Have my respiration, that is my lungs, need to work in coordination. My throat, my vocal cords need to work in coordination. My articulators need to move in coordination. And my brain needs to be telling exactly what words, what sounds, in which way it should be moving. So all of these things, if it needs to work together, and I'm looking at speech, which is fine, extremely fine muscles, okay, like they're as small as these such small muscles that need to work in coordination for us to say a single sound. I'll take a very simple example, which I tell all my parents is, if I have to say the word pan, my breath support needs to come in, my vocal cords need to move, and for each of that, there's a different placement in my mouth, which needs to work in coordination for me to say pan. We say pan very easily. But for my jaw needs to be stable, my lips need to close, my lips need to open, my tongue needs to go up. There's so many movements that need to happen together at the same time. So when this is affected, that's when we have a lot of children who come in, and when they have coordination difficulties, you are going to see that a child definitely has speech difficulties. So if they're having difficulties in their gross motor skills, if they're having difficulties moving bigger body muscles, okay, that's where gross motor comes in. If they're having difficulties with that, there is 99.9% chance that they are going to have difficulties with these fine coordinated movements. Some children might say a single word, but when you go into telling them to talk in a sentence, you will see speech clarity becoming an issue because the words get slurred, it gets mixed up, and it's not clear. So it's very, very important. So it's like when you're looking at a child, we always say, don't look at a child just by, okay, just the speech difficulty. We're looking at a child as a whole. So we have to see if there is physical. That's why I tell all my parents, go just do an assessment and see. If it's not there, hey, great. The child does not have a lot of difficulties. It makes working on their speech easier. But if there is a foundational difficulty in their gross motor skills, in their sensory skills, if that is there, if they have reflexes present, all of this, it is going to affect their speech, and that is going to be a big difficulty. So very, very important to have all of this working together for a child. So I hope, yeah.
I hope this was a very enlightening conversation what Sarah made. I would like to invite all the parents here to ask any speech and language question from Sarah.
So I have one question.
Yeah.
As in the science is evolving, technology evolving. I see a lot of US boys. I mean the students or something. They have spoken first time after 8 years, like at the age of 8, 12, and all. I read and I feel a lot of inspired by those things. So, but generally, when I went to Newman, they have this big board saying 99% of the brain growth happened till 5. After that, it's closed down. I was trying to read in the morning today also. So, what is the chances of a child speaking independently after 5? What is that the parent should, be aware or have? I mean, what I'm trying to say is the setting the expectation right. Okay, because we all have think, okay, we will do this, we'll do this, we'll do this, we'll give all peace, everything aside, and do this, 10 things before we go to bed, so that my son can speak after some time. So what is that? Maybe that, and if it does not happen after a few years of too much thing, that might add to somewhere, that okay, of course you have to take it like a sweet thing, but you have to something, okay, I have done so much, but then also I don't see the result coming in. Yeah, so maybe what, so then you have to keep your facts right and work on the right path. So what are those right path, and what is the chances and all that, if you can summarize?
Okay.
So,
what
you
is
see, like multiple questions.
multiple questions.
So I'm
So I'm
going to
gonna
try.
try
Hope I
if I
answer
answer
all of
all of
them. If I
them.
don't, you can ask it again. So one of the very important, and this is something that we
all learned, in all of our in our courses and stuff like that. We learned something called neuroplasticity. Okay, so that is where this whole topic of a child within 5 years, they will have to learn to talk, because what they're trying to say is that the brain is at that time, the growth is really rapid. It's not that the brain is not growing after 5 years. We all learned after 5 years. We all still learn, like now also we learn a lot of things. It's just that if you think back, how you learned in school is not the speed that you can learn in right now. Yeah, if you ask a younger kid to just memorize a whole portion of this thing, they will do it, because the brain is able to do it that fast, and it's like a sponge. They're able to take in everything at that speed. As you keep growing, that plasticity, it's not that it goes off, it's just that it takes a lot more time. Okay, so when we say, why we say the 5 years, or why we tell parents, is that because early intervention always gives better, you have better prognosis of, so there's a lot more difficult, otherwise the difficulties also, it is where okay no, yeah. So that is a very important thing. That is one thing about in terms of neuroplasticity. Okay. Then the next thing what happens is that when we're talking about in terms of whether the child can speak after 5, we have a lot of children who start picking up speech after 5. It's not that they don't. They do pick up speech. They do as an, because again, why the child is not able to pick up speech is because there is a lot of, it's a normal child, or somebody who is a verbal child or anything like that, there is not a lot of difficulties in terms of their motor speech system. Okay, sensory motor issues, they don't have a lot of that. So they're able to look at me, they're able to, none of us will sit with a child and tell, okay, look at me do that. We don't normally, they just pick up as they go, they're listening, their environment, they're able to do it. But when we're looking at our children especially, they have so many other components that are difficulties for them. So when I'm working on that, as and when we are able to build up, again, to increase my neuroplasticity, I have to keep practicing, keep doing that, and then the child picks up. Sometimes it will be, some kids, they might pick it up maybe within 10 trials. Some children might take a much longer time for them to pick up, because that's on how severe the problem is, or whatever, how difficult it is for them. Okay, so very important to understand is that I would always say is, don't keep, see, if you have an expectation, you're going to put that kind of pressure on your child. Yeah, when I'm not saying don't expect, have hope that your child is going to pick up and you're going to speak. But the very important thing that I want to highlight here, and I want to say, is that if you're going to wait only for speech, if you're going to wait for your child only to talk and then only he is independent, it's that is where we go wrong. Okay, so if you think that a child who communicates non-verbally is not as par with the child who is communicating verbally, that is where the equation goes wrong. Why is the child not communicating verbally? Because the child has so many difficulties with the whole entire system, motor system. Okay, it's not that they don't want to do it. The number of times I've heard parents come to me and say, ma'am, my child is lazy, he knows words, he's not talking. It's not that he's not talking, it's just he doesn't know how to put all of, my brain needs to function, my brain needs to have an idea. Okay, I want the purple bottle, Divya, can you please, my brain needs to tell me that to do that. When this is not happening, I always tell, like, even for example, if I have to take that phone, My brain needs to tell every single joint and muscle of mine, this is how much you move. Imagine trying to do that inside the mouth. It's so precise, it's so fine, every single movement is so right now. This is a gift to be able to talk at this speed, at this rate. It is something we take for granted. So it's a miracle, really. When you study how in depth it goes, it's very hard. So when that comes in, when we know that the child has difficulties, I will never say we are working to better the to what do you say, to get them to come and become, to have at least, basic communication. Can they do speech? Can we get them to say a few words? Can we, again, there's a whole hierarchy of how we work on that. But at the same time, if we keep okay, within 1 year my child has to talk, that's very hard. You're putting like I've seen that with so many parents, and that what it happens is it puts unwanted pressure on you and the child as well, because you're like, oh, he's not talking, so he's not independent. I know we are in a culture, we are in a society where if the child is not talking, the child is no one. But especially for our children with autism, it's not that, it's just a speech difficulty. It's not that they're not thinking. It's a big difference. It's a big difference when you see that a child who can, that's why the whole difference between communication and speech comes in. That's why I always tell my parents, let them, if they pick up speech, hey, well and good. But at the same time, speech is not the only thing I'm going to focus on. How can I get my child to independent? Like that was one thing that we want. We want them to independently communicate. We want them to, so communication can be verbal, can be non-verbal. Non-verbal is I can be using a device, I can be using signs, I can be using gestures, and all of that communication is considered. The moment what happens, and this happens in a lot of places, is you'll tell the child, no, the child has to say, then only we will give. The child is not saying because the child has a difficulty. So if I can give something that makes the child's communication, and he's crying, the frustration is so high and he's crying, and if I can just get him to point and say, okay, I want to eat, or I'm hungry, or I'm tired, or this is paining. When does a child show that frustration? When he's not able to communicate and show that to us. So it is so important that along with working on speech, we're not saying that it won't come in. It can come in. We've had children at much older age pick up speech. But again, if you're looking at the clarity and looking at them talking like how we're talking, it might be very hard for them. It'll be very hard. Yeah. So at least that, so they might pick that up at 10. At 10 years they might pick up a few words. At 11 they might pick, we don't know. If we put that kind of this thing and say, okay, fine. But when I give them an opportunity to communicate, I'm giving them, hey, I'm not depending only for you to speak. I'm giving you another access. So that is very, very important. It's not that speech doesn't come after 5. It's just that how functional or how precise and how clear it can be, it just becomes a little more harder for the child. That's all. That is what it means. I hope you got an idea.
I will add a point here, though I am going to elaborate it in the psychology time. Co-regulation. Without co-regulation, nothing, I mean, things are going to be much longer. The journey is going to be much tougher. Co-regulation is the foundation, is the key for our children to able to start connecting with us. So you have to understand co-regulation. Co-regulation leads to social communication, which leads to the motivation to use language. Motivation for communication. So if co-regulation isn't there, there is no need for my child to even be willing to communicate. And when there is no willingness to communicate, speech is a motor act.
Yeah.
So regulation is very important, and regulation is the effect of right postural system. So see, we are just trying to connect every dot. So how my PT is connected to my speech, right? So postural system leads to regulation. Regulation leads to intrinsic motivation for me to be able to learn and use my skills. So one thing we really ask our parents to join the program, for some programs for developing co-regulation. But unfortunately, we do not understand the importance of co-regulation. We try not to choose it and only choose speech therapy. And this is what we are continuously trying to make an effort to create that awareness. I will not talk about it in detail because my time will come. Okay. Any other question? Please, Sarah is there today. Like, it's not easy to get Sarah. She's such a busy therapist. Today, you guys have got the opportunity. Please bring it on, the questions. Sarah, are there questions in the list? The questions in that we can answer them.
In that,
In the
there was They were just asking about speech therapy, just in general.
Just in general.
General, just
Um, do you want to share something if the questions are not coming? Do you want to, whatever you share, like,
okay, so I think I'm just kind of for everybody who's here. I don't know. We've got parents here who've been with us for some time, so they know how we work. For all those who are joining online, if you have attended speech therapy, what exactly have been your experiences and things like that. Now, as a speech therapist, we definitely, that's why we work with a multidisciplinary team, is because it's not just speech is like ma'am was saying, it's a motor act. It's one of the most final things that the child will, especially children who have dyspraxia, it's one of the most difficult things that they will have. But you have children who are verbal that will pick up. So as a speech therapist, when you come to us, you do come in with concerns of the child not talking, but we also do focus on just not only just getting them to verbally talk, we focus on their understanding of language. We focus on how much they are able to understand, how much are they able to express themselves. Children even who are verbal, we think, okay, my child is talking, so my child knows everything. Okay, but they might be, especially a lot of kids, they learn things very rote, especially children with autism. They have, their systems are in place where, you know, it's black and white. There's not, they're not able to flexibly think. And again, ma'am will talk about dynamic thinking and all of that. We come in there to get them to kind of know that we look at, if my child is communicating, okay, I want, I need, you know, we think that is it. But we use our communication for so much more. We use it to express we don't like something. We say, I don't want that, I don't want to eat it. It's okay for us to say those things. Or so when our child says no, we're like, no, 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 but you still have to do it. You know, that we were very used to doing that with our kids. But, you know, we don't give them the autonomy of saying, okay, you say no. We have to draw the line. As parents, as therapists, we draw the line. But very, very important that we use communication to express. We use communication to remember, tell things that have happened from our past, to do all of those kind. And these are all skills that we do definitely focus on. It's just not getting verbal speech. Again, children who have sensory motor issues will most of the time also have issues in terms of feeding. So very, very important aspect to look at is, again, if you come to us, we have a lot of things there, but if there is a child who has a higher risk in terms of feeding, and they're picky eaters, or they've got sensory issues which is affecting their feeding, we definitely do have to keep that as one of our main focuses to work on. Because if nutrition is not there, if the body is not able to function, there's no point in getting speech if the child is not able to do that. So very, very important to work on that. We work on their communication and a lot more. I have Abhishek, who is my colleague, and another speech therapist who is with us, and he will also add what we work.
yeah, so I can actually ask specific questions.
Yeah.
So, Abhishek, especially, I would like to ask you the importance of AAC. We see generally tend to think if we put children on AAC, my child will never talk. The speech as an act will not come. And there's a myth that AAC is going to take away speech. And we are so, I mean, I have actually met with so many speech therapists, also those who do not recommend AAC. I would really like you to share your opinion and experience about AAC and how should that journey be and where can it take us?
So AAC is something that I really suggest for parents who find their children having communication difficulties. We have I personally have seen children who use AAC really well, even if they are speaking or non-speaking. Or I have seen children doing really good in terms of communication. So ACE is like a wonderful tool, or let's say the thing that people have created for people who have communication difficulties. And so I use all different kinds of AAC in my session. So I use picture boards, I use apps. So I use different kinds of modes of AAC to help the child communicate in the session. So it's not just that it will happen in one day. So you can see changes as you do, like every day. When you do consistently, when you practice it, and when you take up that the chance to practice it in across different institutions, you will see changes, and you see that over time that the child has has progressed so far in terms of communication. And not just that, you will see that the child's behavioral issues has come down after after when you introduce AAC. And also the child is going to have a meaningful communication with other people, and also child is able to create friendship with other people. So, and imagine that if the child doesn't have one way, a specific way to communicate the child's interest or make a friendship with another person, it's going to be difficult, right? So this is a wonderful tool that, if we adopt, you can see the child progress in terms of communication, make friendship, and a lot of other aspects. It will be really a good tool.
Just to
What does the research say about development of speech when we put child on AAC?
So I have personally seen children developing speech after they use AAC. Like, for example, a while ago, when I was taking session, it was the child was I was trying to teach emotions specifically, and when the child touched the word happy, the child was able to say happy. So it is again a way for the child to learn new vocabularies, and also giving a space for the child to say words. So that's something I have seen personally. The child has started saying words after they introduce AAC into their sessions.
just to add in for all of the people who don't know what AACs are, I don't know how many of you all have this thing is it's something called alternative augmentative communication. Now, like I said before, speech is verbal. We have a child who is again able to speak, but children who have speech difficulties or who are non-verbal, who don't have, doesn't mean that they cannot communicate. Like I said, so when we are communicating, we use verbal. Even we use a lot of non-verbal communication, to kind of express and tell, okay, we don't want that. We might just nod our head. We might say, we might tell, come like this and all. So we use a lot of signs and gestures. And so a part of that, when children have who are minimally verbal or who have speech difficulties, we use communication devices that either help augment their speech. You're giving them another modality to speak, and or we can also give in term with children who have severe speech difficulties. This becomes their communication device. We all use it. All of us use it in WhatsApp. How many of you call your husbands or your people and tell please come? It's just a message that we do. So we want our kids also that, okay, if they have a speech difficulty, if they're minimally verbal or they have difficulties, we are giving them another modality to communicate. Again, a non-speaking child is not a non-thinking child. Very, very important. Okay, they have a mind, they are thinking, they are doing. We're just giving them an aid to help them communicate better. So
I have a question, Abhishek and Sarah, to both of you. Will you use AAC only for non-verbal children? Or will you use AAC for children those are minimally verbal or partially verbal, moderately verbal also? So when do you think you will bring AAC for and even for verbal children, how AAC could be useful? So if you can like put some light on this.
So a lot of therapists or a lot of people, we have this idea that AAC only comes in, it's your last resort. You only come in if the child doesn't talk. No, that's a big no, because a child is communicating right from day one of birth. We are just going to, so I tell many parents who come in, if I see that the child is finding it very hard, not just very hard, but I'm seeing that the vocabulary is limited, the speech is limited, the child isn't able to express themselves, we bring in an AAC right at the beginning. So that becomes a thing that we start right from the get go. We are not waiting for, okay, we worked on speech for 6 months, speech is not coming, and then we introduce an AAC. Right from the beginning, we do bring this in. And it is not just to express needs, like I said before, it is not just to express needs, it's to express their ideas, their thoughts, their feelings. We do all of that verbally. Can our children, if not verbal, hey, it's okay if they do it non-verbally. So AAC is an important thing, goal, that for all children, I think, especially children who are much more on the expressive side and they're able to express everything, we might not bring that in immediately. But most of our children who have difficulties in terms of expressing things, we definitely do bring AACs.
To add another point, so I have to ask, you can ask this question to yourself. So you can ask that, can your child do request things? Can your child, if not, then we need to do AAC. How many communication attempts, or let's say functions, can your child do? Like, can your child request things? Can your child comment about the child, what's seeing on a picture, or that the child seeing on the environment? Can the child answer questions? Can the child ask questions? these are all important communication functions that we all do in our day-to-day life. If your child is verbal and if you still feel that the child is not able to do all these communication functions, like this variety of communication functions, if you feel that, then it is important for us to use AAC. So that will help the child to learn new vocabularies, and also at the same time the child will able to do this variety of communication functions, which is important for us today in our day-to-day life. So that's how I think about AAC when it comes to uh, communication.
So I think we have to go to our OT hour, but before one last question, I will ask to my speech team. If you have no other question, if you have question, please, I'm inviting you again and again. Come unmute yourself and ask the question. Um, uh, one, I don't know how to put it. Okay. The language processing style, the latest research which is telling about. So can you quickly tell our viewers about the language processing style of children? And as a speech therapist, what do you do? How do you help?
Yeah, so this is right now, I think a lot of, now research that is coming up right now. We've got two language processing styles that we look at, which are both normal. Generally, most of the time, our children with autism, especially those who are verbal, we see that they have echolalia, or they have repetitions. They keep repeating what we're saying, or they repeat things from cartoons, what they watch. They'll just be going on. They even pick up the accent of how the child speaks, and of how they hear things on the TV and in their environments. So that is something that we see. Echolalia is just one sign, but we have children who've got high intonations right from their in their developmental phases of 1-2 years. They generally might not just say. So a normal, we've got two. We've got the natural language acquisition, and we've got gestalt language processing. Okay, so when I say natural language acquisition, that's what we all know. That is, a child will start babbling. After babbling, the child will start saying the first word. After saying first word, we'll put two words together, from there to phrases, and it goes on. It's a very, so child says it goes to ball, then it goes mama ball, then it goes to mama give me ball. That's a very natural way that a child picks up language, and that is what we've seen so far. But with children with what do you call it, gestalt language processing, okay, those who have gestalt language processing, they don't pick up language like this. So they are generally children who they have increased echolalia. So they have either delayed or immediate echolalia. They keep repeating things. They pick up songs. They pick up tunes. They won't functionally use. I have a lot of parents. The child has vocabulary, but the child will sing it in a song, but the child will not functionally use it. Okay, so there are things like this. They say those words in something, but they're not able to use it in a functional way. This is something that we see and we call as gestalt language processing. Now, first thing. Do not try to stop your child when they do that. Okay, it is a very normal process. They first start with, they learn words as chunks. Every time the child wants a chocolate, he will be like, he might just say brown chocolate, or whatever is that gestalt or that chunk that has stuck to them, and they will stick to that, and they will only keep saying that. They're not going to say give me chocolate. They'll just keep saying brown chocolate. Even that is communication. It is not wrong. They have a whole stage of development that they also go through, even in their gestalt language processing, and they learn how to communicate with that. So when we do that, when we kind of try to know, you have to only say give me chocolate and then only I'll give it to you, we're kind of limiting again what they're trying to communicate. There are any word that or anything that your child does is communication. So there is a whole process. So I would generally tell parents is, if they are a gestalt language processing person, we can't go into asking them questions, because if you say what do you want, your child will also say what do you want, what do you want, what do you want. This is what they're going to do. But the way we talk, how we talk, there's a lot of things that we will go into detail. So if your child, if you're seeing certain signs that your child only likes singing, only sees, please do reach out, because there's a whole different way that we take in terms of giving them therapy.
Thank you, Sarah and Abhishek, for your valuable inputs. And